Ito ang Broad Streamcast Communicators, ang naiiba at kakaibang plataforma sa digital broadcast mula Luzon, Visayas, Mindanao hanggang sa iba't ibang dako ng mundo. Broad Streamcast Communicators, ang sandigan ng sambayanan mula sa walang labis at walang kulang na pagbabalita, paglilingkod, maglalahad ng mga mapagbuong komentaryo at usaping pambayan para sa kapakanan ng karamihan. Broad Streamcast Communicators, tuwirang maglilingkod ngayon hanggang sa susunod na henerasyon. Buhay Online, chikahan at kaalamang pangkabuhayan. Ating tunghayan, pakinggan at tuklasin ang mga pangyayari at kaganapan sa mundo ng online. Buhay Online, chikahan at kaalamang pangkabuhayan. Alamin ang pinaka-latest trends mula sa trabaho at kung hanggang saan na ang narating ng teknolohiyang ito. At ngayon, narito na ang ating host, ang ating Techie Mami, si Jaye C. Bautista.
Hello everyone. Happy Thursday morning. Magandang umaga sa lahat. And tumigil na yung ulan. Very good. Pero palabas na yung bagyong Julina. Pero I think meron parating na iba pa. But anyway, it's such a beautiful and bright, well, not so sunny, but it's a little bit cloudy. Pero at least tumigil na yung malakas na ulan. So hindi na ako nag-worry masyado tungkol sa pagbabaha. Dito sa Pampanga, nagbabaha rin, tsaka sa Marikina, of course, where I'm from, right? And welcome to our friends to the show today, dito sa ating Buhay Online. Hindi ko pa nakikita yung pangalan, of course, at least kung sinong nandyan, but welcome. Happy Thursday po. So, anong mga magagandang balita meron tayo today? Well, of course, trending sa news at mga, di ba, ang technology, yan, social media is very big technology, and of course yung paggawa ng mga meme, yung mga ang nagte-trend ngayon is nagte-trend is yung sa entertainment, yung si Paolo Contis tsaka yung paghihiwalay, ano ba yan? Araw-araw naka-intrude yung news na yan tungkol kay LJ at Paolo Contis and whoever he's seeing, whatever. At hindi pa yon, of course, ito rin yung matter of si Isko at saka ang ating Pangulo, ang kanilang bangayan, online bangayan. Very, and also, yan nga, kasi sa social media, this is now the venue ang ating news, nakikita natin lahat online, right? Plus, yan. Tsaka yung, yung pagiging fickle-minded ng ating gobyerno sa paiba-ibang level ng restrictions. ECQ, GCQ, MECQ, ano ba, di ba? Sabi nga nila, dapat nagtotoscoin na lang yan or ng tambiolo kasi pa iba-iba, naguguluhan yung mga tao. But I think it's just as well, of course, for businesses, it's bad na ECQ ulit or MECQ ulit kasi hindi ma-restart yung ekonomiya sa ganun. Pero yun na nga hindi ko na masabi kung ano pang kailangan gawin kasi lahat na ng formula ginawa kasi hodang MECQ, ECQ, whatever. Tapos ngayon, di ba, mas marami pa nga yung infections ngayon, even with the vaccination. Kasi nga, siguro, naging complacent mga tao, feeling nila pagka may bakuna na, pwede ka nang gumalagala, no? Pero mali kasi nga, all over the world, like even now in America, they're proving na, it's not so. Our normal lives for now will have to be wearing masks still, diba? Kasi nga may infect ka pa rin, kahit na nga may bakuna ka, na-infect ka pa rin alright? So anyway, what are we going to talk about today? Of course, maraming bagay kasi kahapon nagpatuloy tayo sa yung mga latest news, yung mga breakthroughs ng technology, especially involving mga Pilipino, right? So let's start with information, of course, in technology news, right? Uh, ang technology news itong ASTI launches app to give public peek of outer space. Ito ay galing sa Philippine News Agency, okay? With the goal of giving a preview of outer space, di ba? Kasi lately, di ba, nasa news palagi tayo, yung Filipinos na nag-aaral tungkol sa outer space, baka mamaya, di ba, meron na rin tayong astronaut na papadala sa sa moon or sa whatever planet o yung pag-discover ng ninth planet na yan, malay nyo. Kasi nga, gumagaling na rin tayo sa teknolohiya na which involves outer space, right? And so, with the goal of giving a preview of outer space, okay, the Advanced Science and Technology Institute or yung ASTI, teka, meron akong graphic dyan, alright? Ito yan. Okay. Ito, okay. Ayan, alright? On Wednesday, past Wednesday, they launched the free virtual reality simulation app. Okay? Meron silang nilaunch na app available on Google Play Store. Okay? The DOST or Department of ang DOST, okay, in cooperation with ASTI, okay, itong ASTI, yes? Hold on a second. Ayun na naman itong mga delivery. Ako, nagsishow po akong programa, sandali lang ha. Alright? Because I have to call my son. Pasensya na po. Meron na namang delivery dito. Okay? Ayan, technology. Nung nag-uusap kami ng anak ko, hello, Kiani, there's Shopee delivery again. Can you come down, please? Kiani. See, we use a walkie-talkie. Ito, technology. Nasa second floor kasi anak ko. Kiani. Paki-doorbell nga po. Anyway, so there. So I was saying, no, yung DOST VRS app features a comprehensive computer-generated simulation of ASTI's ground receiving citations. Receiving stations, okay? In Metro Manila, Davao City, and Iloilo. Okay? It also includes a satellite showcase where users can learn about Filipino-made Diwata and the Maya satellite. Excuse me, food also, can you pick up the food right later? All right, okay? It also includes a satellite showcase where users can learn about the Filipino-made yung Diwata at saka yung Maya satellite, as well as the different commercial satellites, kunyari, yung Philippine Earth Data Resource and Observation Pedro Center subscribes to, okay? Diba? Nung last 2 weeks bago, nilaunch yung Maya 3 and Maya 4, yung ating cube satellites naman, diba? Internationally, nilaunch yun sa Amerika. Excuse me. Gumagaling nga tayo talaga sa aerospace technology, right? Yung app development could enable the public to still explore the GRS as facility tours cannot be done amid the coronavirus disease pandemic, di ba? Kasi nga hindi tayo pwedeng physically sumali, no? So, lahat virtual muna, right? This is our creative attempt to bring space closer to the Filipinos, diba? Ito, you can actually do an interactive tour through this app para magkaroon ka ng view na outer space. Galing, diba? So, Filipino ang gumawa nito. The interactive tour will let them explore the 3GRS and the locally made satellites, yung ating CubeSats, all by using this app, okay? Ito sinabi ng Department of Science and Technology or DOST Secretary Fortunato de la Peña during the launch last week, okay? He added that the app will help the public get a bigger picture of the potentials of space technology na talagang, like I said nga, lately, malaking interest dyan at gumagaling ang Pinoy sa space technology, aeronautics, and all that, okay? Yung sa mga taga-UP na napadala, mag-aral right sa Japan, at the same time also yung ating Maya satellites na pinadala. Maya 3 and Maya 4. That was launched internationally, right? Okay, so We hope that this would help raise public awareness and inspire everyone, especially the youth, sabi ni Fortunato de la Peña, to take interest and grow an appreciation for space science research. Okay, the country's first GRS in Quezon City houses a 3.7-meter Earth observation or EO satellite tracking antenna. The second GRS, inaugurated in 2019 sa Davao City, houses a 7.3-meter EO satellite tracking antenna naman. Meron din tayo sa Iloilo City, which is still under construction and will house a 3.5-meter EO satellite tracking antenna according to ASTI. Okay? Itong app also showcases Pedro Center's operations such as transmitting, receiving, and processing of data to and from the satellites. Okay? Ang Pedro Center or the Philippine Earth Data Resource and Observation Center, Pedro, okay, oversees the GRS facilities including satellite tracking antennas that receive, process, and distribute satellite images and other spaceborne data that can be used for environmental monitoring and maritime surveillance. Galing, no? Alright? Good job. So, ito yung news tungkol sa pag-launch ng ASTI app, which will give us, the public, a peek of outer space. Cool, no? This is based on news that was from Philippine News Agency by Maria Cristina Arayata. Okay? Kasi nga, ang goal nito is to preview outer space. Alright? So, ang DOST at ASTI app na ito features comprehensive computer-generated simulation of ground receiving stations, yung mga GRS. GRS is ground receiving stations in Metro Manila, Davao at Iloilo. It also includes a satellite showcase where users can learn about the Filipino-made Diwata at saka yung Maya satellites, yung Cube satellites na nilaunch internationally, di ba? Pati yung mga commercial satellites. So, dahil sa app na to, pwede mong makita yung kung anong nakikita ng mga satellite na yon. I think that's pretty cool. Right? Very good. Okay. So, on another note naman, okay? Sa health naman, right? Pinag-usapan natin ang health and technology, alright? Paano natin mapaprotektahan yung sarili natin indoors against the coronavirus? Okay? Alamin natin, right? There are ventilation and air filtration things that we can do. Okay? Goodbye to this one. Alright. Alright? Ito naman ang topic natin ngayon. Next. Ventilation and air filtration. How to prevent the spread of coronavirus indoors. Alright? Paano makakatulong? Alright? Ayan pa ito isa. Okay. Let's see. Alright. The vast majority ng mga SARS-CoV-2 transmission occurs indoors. Talaga. Yung ibang infections mismo talaga nangyayari, of course, sa loob. Hindi naman isasabi indoors sa bahay. It's indoors, for example, sa restaurant, sa sinihan, sa mall, indoors yan, right? So, the vast majority ng transmission occurs indoors. Most of it from the inhalation of airborne particles, okay, that contain the coronavirus. Yun na nga, airborne talaga. The best way nga talaga, of course, to prevent the virus from spreading in a home or a business establishment, okay, would be simply to keep infected people away, okay? But this is hard to do kasi hindi naman natin alam talaga. Kasi most of the time, sabi nga nila, 40% of cases are asymptomatic. Ano ulit yung asymptomatic? Asymptomatic is from symptom, signs, walang signs ng mayroong sakit, wala man lang ubo or sipon or fever, pero contaminated ka na ng virus. You are a carrier of the virus and marami dito, young people are like that. Right? The people that go out and go to public places sa iba-ibang country, anywhere, sila ang may dala nito. Kaya, yan sila, dadalawin nila yung grandma nila, grandpa nila, hahawain nila. Or yung mga magulang nila, right? So, kaya nga, 40% of cases are asymptomatic and asymptomatic people can spread the coronavirus to others. Of course, we know that now, right? Masks, of course, do a decent job keeping the virus from spreading into the environment. But, if an infected person is inside a building, inevitably, some of the virus will escape sa air. Yun na nga, airborne na siya. Okay? So, based on this resource na nabasa ko, right? Okay? From SciTech Daily, health news ito, okay? Itong si, excuse me, Shelley Miller from the University of Colorado, okay? She is a professor of medical engineering at the University of Colorado, Boulder, Colorado. Tapos she has worked on how to control the transmission of airborne infectious diseases indoors, okay? So siyang nagbibigay sa atin ng advice paano natin ito mako-contain, right? How to make indoor spaces safe during this pandemic, alright? O kuha na kayo ng ballpen at papel. Ballpen at papel nowadays sa telepono mo na lalagay sa notes, right? Or sa computer. Sa iyong sticky notes. Once the virus escapes into the air kasi, sabi niya, inside a building, meron kang dalawang options, alright? Pag na-release ng virus, bring in fresh air from outside, ayan, buksan na bintana, or remove the virus from the air inside going out. Diba? Makes sense. Kaya nga lang sabi, buksan ang bintana, wag mong ikulong ang sarili mo. Yung bahay nyo, i-air out mo. Kasi yung mga, diba, iba, naka-aircon dahil sa init. Pero yun nga, excuse me, doon sa aircon na yan, diyan mo kinukulong yung virus sa bahay mo. Right? Okay. Hold on a second. Hold on, please. Pasensya na lang po. May sasagutin lang ako sandali. Okay. Anyway, so yan. So, yung ibig sabihin nga, once the virus escapes into the air inside a building na enclosed, meron kang dalawang option na i-address to. Either i-flush out mo yung hangin na yun na nasa loob palabas, or okay, bring fresh air from outside. So, in so doing yun nga, yung buksan ng bintana. All of the air in a room kasi should be replaced with fresh outside air at least 6 times per hour. Kaya no? If there are a few people inside, pag konti lang ang tao sa bahay, kagaya ko nito, oh, di ba nakikita niyo naman, itong situation ka dito, sa kanan ko bukas ang pinto, bukas ang bintana, may screen. Normally, kung hindi ako nag-aircon dahil malamig today, yan, ini-air out ko tong bahay. So, kung may nakapasok man dito na virus, linalabas ko na yun. Pero hindi ako nakamask, of course, dahil nag-broadcast tayo. But, that's one way to do that, okay? Alright, and the safest, it's all about fresh outside area, okay? The safest indoor space is one that constantly has lots of outside air replacing the stale air inside. So kaya nga, yung mga ating mga kwarto, yung mga tulugan natin na naka-aircon tayo palagi, nakakulong dun yung air. So kung yung virus dala-dala nung kasama mo na lumabas para magtrabaho or may errand na ginawa, of course, supposedly, naglinis na siya ng katawan and all that, or nag-disinfect na, right? Pero just in case may nakalusot, huwag niyong kulong dun sa kwarto, okay? In commercial buildings, all right, outside air is usually pumped in through heating, ventilating, and air conditioning systems. Ito yung mga mall, diba? Kaya nga sa mga mall, diba, ayaw nating mapupuno ang mall dito sa Pilipinas para huwag masyadong maraming nag-suspect ng virus. Tsaka yung mga sinihan, bawal talaga doon ako sa sinihan, doon ako nakulong talaga ng husto. Hindi ka naman pwede manood ng sinang bukas yung mga bintana. Wala namang bintana. In homes, okay, outside air gets in through open windows and doors, gaya itong ginagawa ko, in addition to seeping in through various nooks and crannies, okay? Simply put, diba, ang fresh air, ang fresh air ay outside air inside the building, the better, di ba? The more fresh air na ano natin, ano to? Na napapapasok natin sa loob ng bahay. Basta yung nasa-circulate, mas mabuti, okay? Bringing this air kasi, Sorry. Okay, bringing this air dilutes any contamination sa building. Whether a virus or something else or kung anong klaseng bacteria or whatever, it reduces the exposure of everyone inside or anyone inside. Environmental engineers quantify how much outside air is getting into a building using a measure called the air exchange rate. Okay, this number quantifies the number of times the air inside the building gets replaced with the air from outside in an hour. So sabi nga nitong si Miss sabi nitong si Miss Shelley Miller, dapat daw 6 times within an hour na circulate yung air. Mahirap naman. Ayun, hindi na nga, mag-ventilador, okay? Kung, yung ventilador, yan, mabuting yan, pang filter, pang flush out ng inside air to outside air. Itapat niya sa sarili mo, tapos palabas sa pinto, okay? So, this while the exact rate depends on the number of people and size of the room, yun nga talaga. Most experts consider roughly 6 air exchanges an hour. Yung sinabi ko nga, 6 na beses magpapalit ng hangin to be good for a 10-foot by 10-foot room, okay? A 10 by 10 na room with 3 or 4 people inside ay okay lang na i-circulate yung air 6 na beses sa isang oras. In a pandemic situation like we have now, this should be higher. Okay, with one study from 2016 suggesting that an exchange rate of 9 times per hour reduced the spread of SARS, MERS, and the H1N1 in a Hong Kong hospital. So yun na nga. Kaya 'di ba? Kaya hindi nagtataka kung bakit yung sa ospital na-hospital na nga yun, yung mga trabahador o yung mga nag-aantay lang sa hospital ng appointment, nakakakuha ng naka-COVID sa pag-aantay dun. Kasi nga, di ba yung hospital, enclosed kasi yun. Di ba, naka-aircon. So, palipat-lipat lang din dun, airborne yung mga coronavirus na yan, right? So, kaya natatakot yung mga tao talaga ngayon kung when you're feeling bad about something, gusto mo magpa-examine, ayaw mong pumunta sa ospital kasi baka doon ka mahawa. Totoo naman kasi meron namang reason. Lalo-lalo na yung sa emergency room or yun na nga doon sa waiting room na naka-aircon, katakot. Pwede kang mahawa doon. So many buildings sa America, okay, especially yung mga eskwela, okay, do not meet recommended ventilation rates. Well, of course tayo rin, right? Thankfully, it can be pretty much, it's easy to get more outside air into a building. Kaya nga yung mga eskwela abroad, kagaya sa Japan, hindi sila masyadong nag-observe ng strict protocols. Pero ayan nga ngayon, they're getting worse sa pag-spread ng virus, right? Like I said, 5,000 or so a day sa Tokyo alone. Pero kasi, tsaka yung mga bata nila, they have not stopped the students from going to school face-to-face ever. Even from last year, elementary, tsaka high school, at kindergarten, pumapasok. Yung college lang nila ang studying online. And na yan, recent cases, children are getting infected. Sila kasi nagkaklase daw sila na nakabukas ang bintana. Tsaka nakamask sila. Pero like 35, 40 students in a classroom na hindi naman 6 feet away or 2 meters away ang pagitan. So ngayon, medyo state of emergency nga sila ngayon doon. Yung mga schools, hinati nila ngayon ang schedule ng nag-aaral nilang mga bata. For example, 40 sila in a class, 20 sa umaga, 20 sa hapon. Pero yun nga, nagka-COVID pa rin. Kasi hindi sila strict sa mga protocol nila eh. Anyway, so, yeah, they leave the windows open daw to circulate the air. Tsaka when they're eating lunch, bawal mag-usap doon sa Japan. Pero hindi ba, mga bata, hindi mo maiwasan na tanggalin ang mask or mag-usap. Lalo na yung mga little children, mga elementary, naglalaro yun, naghaharutan. Hindi mo maiwasan na hindi magpaluan, di ba? So, it's really, that the children are getting infected now sa Japan because hindi nga nila pinigilan yung pagpasok ng face-to-face school. Kasi nga, it has something to do with economy yan eh. Because their parents, will not be able to go to work because if their children are home. Like nowadays, more mommies now are, more wives and mommies are also working in Japan. Not like the old days na lalaki lang nagtatrabaho. So, ang Japan, yan, parang ekonomiya palaging inisip, di ba? Kaya nga nag-Olympics dun, right? In the pandemic, kaloka. Yun, ayaw nilang mawala ng trabaho or walang magtrabaho pag kung ang mga bata ay nasa bahay. Pero, di ba, the safety of the children, anong gagawin mo? Right? Okay, another way, okay, to protect our how to prevent the spread of coronavirus indoors by ventilation and air filtration. Ano pang other way is using CO2 to measure air circulation, carbon dioxide. So how do you know if the room you're in has enough air exchange? Paano mo malalaman? Kaya nga, kagaya nito, itong bahay ko. It's actually mahirap i-calculate. But there's an easy to measure proxy that can help. Every time you exhale, you release CO2 into the air. Di ba? Every time we exhale, we release CO2 sa air. Okay? So since the coronavirus is most often spread by breathing, coughing, right? Ganyan, right? Kagaya ng ginawa ko. Or talking, you can use CO2 levels to see if the room is filling with potentially infectious exhalations. The CO2 level lets you estimate if enough fresh air, outside air, is getting in. All right, okay? Okay? Hold on a second. Ayusin ko lang tong monitor ko, ha? All right, there you go. Okay. All right? So, outdoors kasi ang CO2 levels are just above 400 parts per million. A well-ventilated room will have around 800 parts per million. So any higher than that, and it is a sign that the room might need more ventilation. Okay? Okay? So last year, mga researchers from Taiwan reported on the effect of ventilation on a tuberculosis outbreak at Taipei University. Okay? Okay. Many of the rooms in the school were underventilated pala. Tapos, and had yung kanilang CO2 levels above 3,000 ppm. When engineers improved their air circulation and got CO2 levels under 600 ppm, the outbreak completely stopped. Oh my gosh. Pwede kaya yung gawin dito sa coronavirus, di ba? Pababain yung CO2 level para mamatay yung virus. According to the research, the increase in ventilation was responsible for 97% of the decrease in transmission. So yun na nga, pag naiwanan dyan sa labas yung mga virus, huwag papasukin sa bahay, mamamatay na sila dyan. Kaso nga, di ba, as long as may mga taong lumalabas-labas pa rin, nadadapuan ng virus, yan na nangyayari, kaya hindi siya nawawala, right? Since the coronavirus is spread through the air, okay, higher CO2 levels in a room likely mean there is a higher chance of transmission if an infected person is inside. Oh, lalo na yung ubo ng ubo, right? Based on the study that I just mentioned, nire-recommend nila to keep the CO2 levels below 600 ppm sa bahay, okay? You can buy good CO2 meters for around $100 online, okay? Bumili na tayo ng CO2 meter. Just make sure that they are accurate to within 50 ppm, okay? So, ayan, ang isa pang natin kailangan bilhin para lagay sa mga bahay natin, CO2 meters, okay? So, pwede ka na umorder niya sa Lazada, Shopee, Alibaba, whatever, I'm sure, okay? Amazon. If a room doesn't have good ventilation, an air cleaner, ayan pa, or air purifier with a good filter can remove particles that may contain the coronavirus. That's why, di ba, nag-proliferate at lumakas ang benta ng mga air purifiers para sa bahay, kung ano-anong klaseng air purifier. Okay? So, ano pang makakatulong ng ventilation at air filtration? Air cleaners. Okay? All right. If you are in a room that can't get enough air, all right? If you are in a room that can't get enough air outside for dilution, okay? Consider an air cleaner. Kaya nga, kung hindi talaga pwedeng ibuksan yung mga bintana or para papasukin yung outside air, consider an air cleaner, also commonly called air purifiers. So, same yan, no? Synonym lang yan. Air cleaner or air purifiers. Itong mga machines na to, remove particles from the air. Wala pa ako nun eh. Wala pa. I have a good mind na nga to order one, right? These machines remove particles from the air, usually using a filter made of tightly woven fibers, okay? They can capture particles containing bacteria and viruses and can help reduce disease transmission, okay? The U.S. Environmental Protection Agency says that air cleaners can do this for the coronavirus. But not all air cleaners are equal, or hindi lahat ng air purifiers can kill the virus. Okay? All right? Before you go out and buy one, there are a few things that you have to keep in mind. All right? Ito yan, ha? Okay? Ito ang dapat nyong malaman at maintindihan bago kayo bumili ng kung ano na lang na air purifier or air cleaner. Okay? The first thing to consider is how effective an air cleaner ang filter niya, okay? Ayan ang dapat nang tignan. Yung filter niya, right? Your best option is a cleaner that uses a high efficiency particulate air or HEPA. Ayan yung HEPA filter, hindi to hepatitis, okay? In this case, HEPA means high efficiency particulate air filter, as these remove more than 99.97% of all particle sizes. Alright? Diba? Coolness. So, yan. Tingnan nyo sa pagbili nyo, ayun na nga, mahirap pag online kasi, meron namang specs doon. Kung ang purifier or air filter na bibili nyo, yung filter ay HEPA filter. Or again, high efficiency particulate air filter. Kasi this removes 99.97 of all particle sizes. Okay? Okay? Ang susunod na kailangan mong konsiderasyon is how powerful the cleaner is. Alright? The bigger the room, of course, or the more people in it, the more it needs to be cleaned. Of course, I work with some colleagues, tsaka mas maraming umuubo, mas maraming nagsasalita, mas maraming tumatalsik na laway, whatever, kasi mas maraming tao. Okay? Itong author, si Shelley Miller, okay, she has worked with some resource people, okay? She has worked with colleagues from Harvard, and they put together a tool to help teachers and schools determine how powerful an air cleaner is. Kasi you need different air cleaners, of course, for different classroom sizes. Ganon din naman pag electric fan, di ba? Hindi naman abot. Yung mga iwata, yung malalaki, mas malaking na cover na area. Yun yung pag dumapat ka doon, tanggal ang wig mo sa lakas. Ganito rin ang mga air cleaner at purifiers. It has different strengths depending on yung size ng room at dami ng tao sa isang enclosed environment, right? Makes sense naman. The last thing to consider is the validity of the claims made by the company producing the air cleaner. Ayun na nga kasi. Di ba tayo, mo-order tayo ng stuff online. Ang daming mga fake claims ng mga products na yan. And minsan pa fake pa tayo ng product mismo. Like recently nga, I ordered this hair, ang tawag niya, Hairball. Hirbal. Hairbal is supposed to promote the growth ng new hairs. Okay? Kasi my hair is thinning out. Napakakapal ng buhok ko dati. And ang dami-dami bumabate. Okay, it's still black. My hair's originally black pa rin. I have very, very few can count the white hairs on my head. Pero yun na nga, it's thinning out. At the rate of talagang nalalagas yung buhok ko. So, nag-order ako nitong hairball. Kasi nakita ko yung ad. Si Vicky Bello yung nag-endorse. Yung pala, my God, fake news. Iba yung Bello product. Hindi siya hairball. Merong gumamit nito ng image niya. Ayan na yan. Mga fake news tsaka cybercrime na rin yan. To sell. They were selling it the same amount as Miss Vicky Bello selling her Bello hair product to promote hair growth. 999 yun, binayad ko na yun. Tapos, ano ba yan? Pinakita ko na yun dati. Huwag niyong bibilin yun. Pagdating sa akin, my God, para siyang glue. was so sticky na nilagay-lagay ko sa buhok ko, wala namang effect. Yung pala, hindi yun yung ganun. So, somebody faked and copied yung ni Miss Vicky Bello and passed it as the product of Vicky Bello na yung ganung efficacy. But anyway, yun. Ilang beses na ako nag-goyo-goyo talaga sa mga nurtures ko online eh. So, please, make sure that you certify the validity of and efficacy of these, the validity and the effectiveness nitong filters na bibili nyo, alright? Okay. Validate the claims of the company producing these air cleaners, all right? The Association of Home Appliance Manufacturers sa Amerika certifies air cleaners. I don't know dito sa atin kung meron nagsa-certify niyan. So the AHAM verified seal, yun, is a good place to start. Pag merong ganun na seal ang AHAM, which is the Association of Home Appliance Manufacturers, dito sa Amerika, naka-certify yan, may seal doon. Sabihin na approved. Additionally, yung California Air Resources Board has a list of air cleaners that are certified as safe and effective. Galing. So, ang California Air Resources Board or CARB ay merong listahan ng mga certified air cleaners na pwede niyong bilhin. As safe and effective, though not all of them are HEPA filters. Okay? All right. So, keep air fresh or get outside. Yan ang kanilang, ang last na suggestion, okay? Both the World Health, get outside pero bawal lumabas. So, tanggalin mo na yung option na yun. Pero yun na nga, what do you call this? Open air. Pwede ka naman lumanghap ng sariwang hangin, okay? Kagaya dito sa probinsya, right? Both the World Health Organization and U.S. Centers for Disease Control and Prevention say that poor ventilation increases the risk of transmitting the coronavirus. Truth be told, kaya nga yung indoor dining, right? Punta sa mga restaurant para kumain doon, air condition yun. Kahit na nakamask ka, of course, tatanggalin mo para kumain, airborne yun, virus. So, habang dinadala yung pagkain mo, pwedeng dumapo-dapo siya doon sa tray na dala-dala yung pagkain mo, hindi mo alam, baba sa mesa mo, right? O, kunin mo bigla yun, lumipat na sa'yo yung virus, nandiyan na sa kamay mo. And of course, you cannot keep naman putting the alcohol before you make subo, diba? So doon din nakukuha, di ba, sa pagkain sa labas, pagpunta-punta sa public places na restaurant, or sa mga bars and restaurants, kagaya sa Japan, they never stopped operation ng kanilang salons, ng gym, ng movie house, ng restaurants, ng bars. Binawasan lang nila yung hours of operation, pero bukas pa rin. So, kaya, ang dami-daming infected ng young people sa Japan ngayon, okay? If you are in control of your indoor environment, make sure you're getting enough fresh air from outside circulating into the building, okay? A CO2 monitor, try to get it if you can help give you a clue if there is enough ventilation. And if CO2 levels start going up, open some windows and take a break outside, right? If you can't get enough fresh air into a room, an air cleaner, okay, is another option, right? If you do get an air cleaner naman, be aware that they don't remove CO2. So, even though the air might be safer, your CO2 levels could still be high in the room. Kasi nga hindi siya naaalis nitong air purifier. Yung mga viruses lang, different sizes. If you walk into a building and it feels hot, stuffy, and crowded, chances are there's not enough ventilation, of course. Turn around and leave. Huwag ka doon sa mga maiinit na kulong. Pay attention to air circulation at filtration. Improving them where you can and staying away from places where you can't have proper ventilation. You can add another powerful tool, okay, to your anti-coronavirus kit is to get proper ventilation, okay, and air filtration, okay. This news, okay, came from Shelley Miller, a professor of mechanical engineering at the University of Colorado, Boulder, Colorado. Okay. So, ayan ang ating SciTech news about filtration and ventilation. Okay? Alright. Oh, ang magandang balita, okay? Pwede ko bang sabihin to kasi di ba ang dami-daming anti-vaxxers. Anti-vaxxers means yung mga ayaw magpabakuna. Di ba? And how ironic. So sorry. Yun, I forgot na the name. There was a rapper, I think he's 29 years old or something. He's an anti-vaxxer. He promotes no vaccination, no wearing masks. Sorry to say, a few days ago, this rapper died of COVID-19. Um, COVID-19 implications, okay? So anyway, itong isang balita, okay, I will grab it. Let me just grab it and show you. All right. Okay, hold on. Gusto ko lang pakita. Kasi dito sa mga anti-vaxxers na patuloy na nagsasabing huwag kayo magpabakuna, mamamatay kayo. Huwag din kayo magpabakuna, mamamatay din kayo. Pag nagkaroon kayo ng coronavirus. Anyway, hold on. Oops, sorry. Okay, let me just get it. I'll just grab it again. Alright, so tapos na tayo dito sa filtration na news. Okay, I can just remove it now to give way to my new topic. Okay. Ay, ano nangyari? Hi! I can see hearts floating by and thumbs up, but I can't see names. Ayaw umakit yung mga pangalan. I don't know who's watching or who's with me today. But anyway, hello, welcome to the show. I don't know if it's my Facebook or my phone or whatever or my OBS na hindi ko na ayata na. All right, there you go. Okay? Ayan. Napak mo na yung mukha. Okay lang. Tawa naman kayo na sa mukha ko, right? There you go. A study of 16.2 million patients. All right? Ayan marami-rami yung inaral na yan. Reveals no serious health effects linked to mRNA COVID-19 vaccines. All right? Okay? Federal and Kaiser Permanente researchers combing the health records of 6.2 million patients found no serious health effects that could be linked to the COVID-19 vaccines. Okay? Kasi yung mga anti-vaxxers dyan, please, shame on you. You know, ano nyo yung ang kapasidad yung sarili nyo to protect yourself against the coronavirus. Please, magpabakuna kayo. Alright? The study published last September 2 reports the first comprehensive findings of the Vaccine Safety Data Link, or VSD, which studies patient records for 12 million people and 5 Kaiser Permanente service. Kaiser Permanente is a medical institution na may hospital din ng Kaiser dyan sa Los Angeles, right? Doon ako dati doktor. Okay? These results from our safety surveillance are reassuring. Sabi to ni Dr. Nicola Klein, Director of the Kaiser Permanente Vaccine Study Center and Principal Investigator of the Vaccine Safety Data Links COVID-19 Rapid Cycle Analysis. Kasi nga, dami-dami pa rin nagsasabing ayaw magpabakuna eh. Hindi tayo accomplish ng herd immunity. Sabi ng isang researcher, Diyos ko, baka sa 2025 pa magkaroon ng herd immunity. Inay, tagal. The world is relying on safe and effective vaccines to bring an end to COVID-19 pandemic. The vaccine safety data link is ideally suited to carry out this important surveillance, and we will continue to monitor the safety of all vaccines that protect against COVID-19. Sabi to ni Dr. Klein. Okay? The study reported findings from mid-December last year through June 26, 2021. Some of the early findings had been summarized previously and reported at public meetings. The analysis compared specific health events among all COVID-19 mRNA vaccinated people during the first 3 weeks after inoculation or vaccination with health events among similar type of patients during the 3 to 6 week period after being vaccinated. Yung total number ng mga tao na evaluated was at 6.2 million. Alright? Ito naman, may tumatawag na naman yung Grab driver. Sorry, pasensya. I'm so sorry. Okay? Ano ba to? Paano ko ba ito masasagot? Hold on, please. So sorry. Alright. Okay. Ano bang nangyari dito? Tumatawag sa akin. Ba't hindi ko masagot? So sorry. Hold on a second, please. Okay, sagutin ko lang ha. I'm so sorry. Hello? Sa tapa. So, 1091. Yung close na gate, right? Okay. Meron dyan tindahan? Hindi, may tindahan. Parang apartment complex, right? Okay. Sige, sige. May lalabas din kukunin. Okay? Thank you. Anyway, so I was saying, right? The search was conducted to it evaluated 6.2 million for the first dose of the vaccine and 5.7 million for the second dose. Okay, the design is meant to compare patients who are similar to one another as possible to reduce the number of factors that could complicate the results. Okay, kinumpare yung mga unvaccinated patients do sa mga nabakunahan. 6.2 million ang tinest na ito. The researchers examined 23 potential health effects, okay, chosen because they had been included in previous vaccine studies, okay? Ang particular concern as an effect of COVID-19, di ba? Ito yung mga ninote nila dito sa kanilang clinical trials. Kinumpare nila yung una nilang mga tests, okay? Pati yung mga COVID-19 clinical trials before were added after public health officials reported increased cases among vaccinated people. Okay, outcomes tracked included neurological disorders such as encephalitis and myelitis, seizures, and Guillain-Barré syndrome, cardiovascular problems such as acute myocardial infarction, stroke, and pulmonary embolism, and others such as Bell's palsy, appendicitis, anaphylaxis. Yan yung mga at saka multi-system inflammatory syndrome. Yan yung mga sinabi nilang nagkaroon yung mga tao after nagpa-vaccinate. Pero, patient medical records were searched electronically and analysts carried out chart reviews of specific health outcomes to verify nga kung itong mga sakit na itong sinabi or itong mga symptoms na yan na is because of the vaccine. So, ang Vaccine Safety Data Link or VSD researchers applied statistical analysis para to determine whether the number of incidents was above a certain threshold or signal. They concluded that none of the target health outcomes reached the signal. Though for some outcomes, the findings were less precise because of a small number of cases lang, okay? Yung authors ng said VST safety surveillance is ongoing, di ba? Ginagamit pa rin ngayon, which will increase the precision of estimates for those outcomes. Okay? The results nitong mga studies na ito is a great example of how seriously CDC takes vaccine safety and how thorough and transparent we are in our safety monitoring efforts, okay? Okay, it is a top priority ng BSD, okay, to do the science and communicate quickly and clearly say na walang large number of people ang nagkakaroon nitong mga sakit na ito dahil sa vaccine, right? Hindi dahil sa vaccine. Okay? So it is the top priority to do the science and communicate quickly and clearly with healthcare providers and the public as COVID-19 vaccines continue to undergo the most intensive safety monitoring. Sa US pa lang, talagang tinututukan nila to make sure and clearly say na okay, it's all right magpabakuna. Getting vaccinated remains the best way to protect yourself tsaka yung mga loved ones natin against the virus. Kasi that has taken already 1 million lives, okay? More than that. The VSD's rapid cycle analysis for the mRNA COVID-19 vaccine will continue tracking newly vaccinated patients for at least 2 years. See? 2 years pa lang. Kasi nga, itong efficacy ng vaccine, inaaral pa rin, di ba? Habang as we speak. You know, ongoing yan. The VSD or the vaccine, excuse me, the Vaccine Study Service, okay, was founded or established in 1990 and led by the CDC, Kaiser Permanente, and other healthcare systems, okay? It is the nation's primary active surveillance system for vaccine safety. Kaya nga, di ba? The study published in last September 2, this is the first comprehensive findings of the vaccine safety data link, okay? Vaccine Safety Data Link or VSD na ginawa ng Kaiser Permanente. It studied patient records for 12 million people na in different regions of America na nagkaroon ng COVID-19, okay? The work is supported by the Center for Disease Control or CDC. These results from their surveillance are reassuring nga because it found out that the world, that the people who had those comorbidities or yung magkaroon ng mga ibang sakit, it is not due to the vaccine, all right? Okay? So this is a surveillance system to monitor yung mga nabakunahan na, okay? The study reported findings, some of the early findings had summarized and reported that it compared na nga yung health events from before to now na thinking na yung mga tao na yun, 6.2 million people that were tested had those other existing conditions already at saka hindi dahil sa bakuna. Kaya sila nagkaroon ng ganang sakit. Alright? Alright? So that's my news about 6.2 million patients reveals no serious health effects linked to the vaccines. Okay? Alright? Salamat naman. Thank you. Okay? Alright. Ano pa? Isa pang magandang balita. Last na pwede natin pag-usapan before we go. Concerning the Philippines, let me see. Ayun, ang Philippines is to establish its first simulation packaging test lab. Okay, technology ito sa Pilipinas ulit. Alright? Ito yun, no? Tara! To establish its first simulation packaging testing lab. Alright. Ano ba ito? Okay? What is this and what is it for? Ta-da! Well, the Philippines is set to establish its first simulation packaging testing lab, a state-of-the-art facility of the Department of Science and Technology, again, DOST, that was featured during the Big 21 and 21 virtual launch. Ay, my gosh, na-feature tayo. Together with yung sinabi ko na isang araw, di ba? The SPTL will be the first performance testing lab for transport packaging in the Philippines, which targets to assist the different Philippine industry sectors in the areas of packaging design and engineering, performance testing, and development of standards for transport packaging using the distribution of goods, and even the packaging used in the e-delivery service. Siguro with safety protocols na rin from virus, okay? Sabi ni Daisy E. Tanya Franca, Chief of the Packaging Technology Division of DOST, she said that the SPTL will help prevent or minimize product damage while in transit, di ba? Kasi ang dami talaga minsan yung mga pagdating sa atin, kuping-kuping yung yung kahon. It will reduce packaging costs, wow, by optimizing the design and comply with regulations para standardized, no? Both in the local and international markets. Galing, okay? The Simulation Packaging Testimony Laboratory, or SPTL, is being established will be at par with other countries. This SPTL is very useful to the different industry sectors, oo naman, including agricultural products, food, beverage, cosmetics, pharmaceutical, personal care, furniture, handicraft delivery services, from micro to multinational, di ba? DOST reported on September 7 that the lab already purchased major equipment that is to be delivered to the site and it's awaiting installation. Ay, exciting naman ito. Ayan ang itsura nitong lab, alright? Ano pa lang to? Scale model. So the Philippines is to establish its first simulation packaging testing lab. Cool, di ba? Talaga naman, very good. All right. Aside from SPTL, which will test for the performance of transport packaging in the supply chain, a green packaging laboratory, okay, green, saving the environment naman to, GPL, is also being established to serve as a venue for R&D or research and development and technology innovations. And anong areas of ng alternative packaging materials from indigenous and renewable materials para ang ginagamit na pang-pack din ay makakatulong sa pag-preserve ng air, right? At to preserve our environment, okay? And so ang gamit dito renewable materials and be derived from agricultural wastes, processes that will reduce energy consumption and solid quick waste. Material reduction din, pati yung quality ng air, recycling at waste utilization. Okay, so di ba, tuloy na lang natin bukas ang pag-usap tungkol dito sa breakthrough na ito. Very good. Thank you so much for joining me. Marami pa tayo talagang pwedeng pag-usapan every day that we are, living and using technology. There's so much to learn, so much to know about, especially about things and processes and services and gadgets that are being developed to help us to facilitate and make lives easier for us, especially in this pandemic. And on that note, I'd like to say thank you so much for joining me sa mga nanood na hindi ko nakita yung pangalan ever. Maraming salamat. Today's Thursday. Meron pa po tayong isang araw bukas para magsama-sama at magkita-kita dito sa Buhay Online. And of course, like I always say, please keep the faith, hope, and love burning in your hearts all the time. Huwag mawalan ng pag-asa, huwag mawalan ng pananampalataya or faith at love for everyone. Thank you so much for joining me, and I hope you enjoy your lunch. Again, happy birthday to Miss Bless Sargan. Happy birthday to Mickey Silva, my relative from California. And thank you so much for joining me. Maraming salamat, and see you tomorrow.
Inyong natunghayan at napakinggan ang mga makabagong pamamaraan sa mundo ng online sa pamamagitan pa rin ng Broad Streamcast Communicators. Hanggang sa muli, maraming salamat.